Welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Bret Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention called nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope that freedom from burden of mental illness is possible. In today's video, I'll help you understand this connection between metabolic and mental health. Why do we think there's such a strong connection between mental and metabolic health? And could a dietary treatment that's metabolism-based improve both mental and metabolic health? And what might this mean for you or a loved one living with mental illness? I'm going to get into some of those details, but first, let's explore what metabolic health is. Simply put, metabolic health is how healthy we are at processing the food we eat and turning it into energy. Your metabolic health determines how you balance glucose and insulin, body fat, and especially visceral fat. Poor metabolic health frequently shows up as weight gain or increased waist size, high blood pressure, or abnormal blood tests such as triglycerides, HDL, glucose, and insulin. And unfortunately, the US trend is not great when it comes to metabolic health, as one study shows only 7% of the American population has optimal metabolic health, and diseases such as obesity, prediabetes, and diabetes are on the rise. Metabolic therapies, on the other hand, are, as the name suggests, anything that improves metabolic health. And this includes nutrition, exercise, and sleep as the top three. We'll talk a lot more about each of these in subsequent videos. But you may be wondering why we believe there's a connection between metabolic and mental health. Well, it turns out that numerous studies suggest that those with poor metabolic health, such as insulin resistance, metabolic syndrome, prediabetes or type 2 diabetes, they have a significantly increased risk of serious mental illness, such as bipolar disorder, major depression, or schizophrenia. And it appears the correlation holds in the opposite direction as well. Those with serious mental illness have a higher likelihood of having metabolic dysfunction. Now, while this doesn't prove causation by itself, it's worthy of attention and should make us curious as to whether metabolic therapies could improve the symptoms of mental illness. Emerging evidence and clinical experience says yes, that it can. But even more importantly, a problem with how the brain uses glucose could exist without overweight or high blood pressure or other signs of metabolic dysfunction. Instead, it's like an invisible malfunction in brain metabolism, and that could lead to the behavioral and cognitive changes we describe as psychiatric symptoms. Now, numerous case reports, clinical experience, and early evidence suggest that a metabolic nutritional intervention such as a ketogenic diet can have significant benefits for treating symptoms of mental illness. If you're unsure what a ketogenic diet is, we'll cover that in much more detail in future videos, but in short, it means that you're reducing the carbohydrates you eat, so your body switches from burning glucose to fuel to burning fat for fuel and produces ketones in the process. And what's interesting about a ketogenic diet is it's been used for more than a century to treat seizures in epilepsy. So you might think, well, that's interesting, but how does that relate to mental illness? Well, it turns out there may be a significant crossover in the mechanisms that contribute to seizures in your brain and what leads to mental illness. In addition, the medications used to treat seizures are often the same medications used to treat mental illness. This suggests a significant overlap and provides background for why a diet helpful for seizures might be helpful in mental illness. Now, we have to be clear, we don't have evidence from large randomized controlled trials proving this to be the case, at least not yet. We do have 5 pilot trials of keto for serious mental illness underway, and the first results will be released in mid-2023. But there are times in medicine when clinical experience is ahead of research, simply because the research hasn't been done. We feel that's the case now for ketogenic diets and metabolic therapies as a treatment for mental illness. And the research for both dietary interventions and medications is starting to catch up. For example, a study using metformin, a medication used to manage diabetes, showed significant improvement in bipolar symptoms for those with insulin resistance. Now, metformin has not typically been understood to have effects on the brain, but it does improve metabolic health by reducing insulin resistance. This study by Dr. Cindy Culkin and colleagues showed through imaging that metformin healed the blood-brain barrier, which could be one mechanism of action for bipolar disorder. We'll get into the studies in more detail again in another video. But this isn't the common paradigm for psychiatric illness. It's revolutionary to show that treating insulin resistance directly improves psychiatric symptoms. This doesn't mean everybody should be on metformin or even everybody should be on a ketogenic diet, and it certainly doesn't mean that people should go off their medications and try this. In fact, nutritional interventions like ketogenic diets are typically initiated while keeping medication regimens the same, at least for some time. Nutritional interventions and therapeutic ketosis are best used in conjunction with medical treatment, and of course with the support of your treating clinician. This is an important point we're going to emphasize over and over again. A ketogenic diet is a serious medical intervention and should be undertaken in conjunction with your healthcare provider. Now, one quote we frequently hear from people who have used this intervention is, the medication saved my life, but a ketogenic diet gave me my mind back. Our goal here at Metabolic Mind is to explore that topic in future videos so you can understand if the intervention could be effective for you. I'm honored to be your messenger at Metabolic Mind, someone who can hopefully help you or a loved one live better metabolically, mentally, and overall. In future videos, we'll collaborate with experts to review the science in an easy-to-understand way and provide plenty of practical tips to help you work with your provider to get started. In our perfect world, people don't have to suffer from mental illness. Rather, they can find effective ways to manage, reduce, or even eliminate their symptoms so they can pursue their path to thriving. Now, you may be wondering how strong the evidence is showing this connection between metabolic health and mental health. Well, in the following video, I'll discuss this topic with worldwide experts such as Dr. Chris Palmer and Dr. Georgia Eid to explore this relationship so you can better understand how this connection exists and what it can mean for mental illness treatment. Now, if you found this video helpful, please click the thumbs up and subscribe buttons, and make sure to share this video with your family and friends and your healthcare provider so you can help spread our message to help as many people as possible. And always, please leave a comment, and we'd love to interact with you, hear from you, hear what you found most helpful. So thank you so much for watching. Please have a great day and take care of yourself and take care of others. We'll see you here next time at Metabolic Mind.